There's a way for you to turn back the hands of time when it comes to your sexual health with testosterone therapy. Joining us now is Rejuveneer's Dr. Cathleen Gerenger. Dr. Kathleen, it's great to see you.
It's great to see you too, Gail.
So as guys age, a lot starts to deteriorate, their muscle and their sex drive.
Exactly, and even their cognitive function and their mood, their irritability. These are signs and symptoms of male having deficiencies in testosterone.
So talk to me about testosterone therapy. What is it and what are the benefits?
Testosterone therapy, our body makes testosterone, male and female. However, men make more testosterone. And on a range of a blood work, their range should be between 800 to 1,000. However, on a standard range, it's from 195 all the way to 1,000. So that range is so wide that sometimes they have these subclinical signs and symptoms of testosterone deficiencies.
So what are some of the main signs and symptoms that a guy's testosterone is running low?
Sex drive.
Okay.
Usually it's their spouse or their significant other. They say, hey, you have to go and see my husband or my significant other because the sex drive goes down. And the other part is the lack of focus, and they're unable to get into that deep, deep sleep.
Okay, so is this something that you do with an injectable? Is it a cream? How does the therapy work?
Well, testosterone, there's a different delivery system. The most, I want to say, common delivery system is the injectable, IM, which means intramuscular. So what they do is that they inject themselves with testosterone at least twice a week, usually a Monday and a Thursday. And the other form of testosterone that they're able to use is called the cream, where they're able to put on their shoulder or their thighs or the buttocks, where it's able to get the testosterone that they need. And the third form is called pellet therapy, where we make a little incision in the buttocks and put the pellets in there, and we don't even have to stitch them up, just a steri strip, and they're good to go for 6 months.
And in addition to better sleep, better sex, all of those things, I also understand it plays a role in lowering cholesterol.
Absolutely. If you look at this steroid hormonal pathway, what we notice is that the cholesterol is made, of course, from the liver. But once we address these underlying cause of deficiencies, it's able to actually help and benefits lowering lipid panels.
Oh, that's incredible. What about Alzheimer's disease? Does it help with that as well?
Yes, testosterone actually passes that blood-brain barrier. And that's why patients coming back, they're like, oh my gosh, I can actually multitask again, and I feel like I have my mojo back. And you can tell that they're able to get really alert, and they feel happy again.
That's interesting. That's interesting. And you know, we're talking about men's health and anti-aging right now, but you also say that women can benefit from this as well, because you think of testosterone and you immediately think of men.
Exactly. And testosterone has such a bad reputation where they think, oh my gosh, it's roid rage. You know, if you have too much testosterone, you grow a beard. And I was like, no, I'm on testosterone and I think I'm okay.
Yeah, you're looking pretty good. So let's talk to me about other anti-aging remedies for men, like peptides and the different nutrients that they should be focused on.
Yes, for men, honestly, they're such simple creatures. I usually tell men, make sure we optimize your testosterone, make sure it funnels down the right pathway and it doesn't turn into estrogen. And they're like, oh, what's estrogen? Man boobs? And they're like, okay, I'm compliant. I'll listen to you. And the other part of anti-aging when it comes to men is peptides. Peptides is like huge. And I talk a lot about glutathione, which is like the mother of all antioxidants. What it does is that it actually lowers that free radical damage. And free radical, just like the previous doctor mentioned, what it does is that it actually shortens your telomeres.
Very interesting. All right, any foods that men should be focused on? I mean, we know that oysters are considered an aphrodisiac. Is that true?
Yes, absolutely.
It is?
Yes.
Okay.
So it's full of zinc. It has very high zinc levels. And I would say for cognitive function, something like walnuts. If you look at the walnut, it's kind of like shaped like the gray matter, which is part of our brain. And then the other part is that, believe it or not, like ashwagandha, dandelions, maca, these are like roots and herbs that you're able to incorporate into your everyday smoothie, where you're able to increase the testosterone level. Or niacin. Niacin is great not only for testosterone, but for cholesterol and also for the circulation.
Very interesting. All right, Dr. Kathleen, as always, we always love having you on Bloom.
Thank you so much.
You're welcome.